in our medical training in the West, this has been shown that beginning in the first year of medical school, the average student gradually loses their natural empathy, that ability to connect with others, because they feel threatened and overwhelmed. And part of the reason that my message is just one heart is that we have to recognize that what affects the physical human heart and its health also affects the spiritual, emotional, and social hearts.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. This is a feature episode. My speaker or my guest speaker on the show today has been is a guest speaker at Parallax before. This is a special occasion because now he has just released his new book, and he's going to tell us more about it. So, my guest on the show today is Dr. Jonathan Fisher. He's a cardiologist. He is a meditation teacher. He's an organizational well-being leader and now a best-selling author. And he's going to tell us more about his new book, Just One Heart. Jonathan, welcome on the show, and thank you so much for doing this for us.
Ankur, it's such a pleasure. I love the work that you do, and thank you so much for having me back on this amazing and important program.
Oh, no, thank you. Pleasure is all ours. We've been wanting to do this. I know that we've pushed this episode, a few months down because we've been waiting for the book to be released, and now it's out. So do you want to tell us more about the book? And, I think for the listenership, we are going to share Jonathan's book link as well as the order link, so that you can go ahead and order a copy for yourself. If you don't follow him already, I highly recommend that you follow him on his social media platforms, including Instagram and LinkedIn, among others. And Jonathan's going to tell us more about his book.
Ankur, thank you. This is a book that I wish I had when I was in medical school and a residency, and then doing my fellowship in cardiology at Mount Sinai in New York. It really is covering, I think, a missing curriculum. It's not a book for cardiologists or for doctors only. It's really for our patients, and it's for people who may be struggling to find ways to find ease, peace, and happiness in their lives. As I went through my own medical training, there was a slow disappearance of my old, joyful, lighthearted self. I was focused on doing well in medical school and then getting into a top residency and ending up practicing at the Brigham. And I thought I had it all together, but at the same time, I felt like I was pretending to be something that I was not. I was really trying to fit into the traditional medical culture. And beneath it all, or behind it all, I was really becoming quite anxious, even depressed. And then eventually I began cardiology practice. And it was a combination of not having enough time to see my patients, feeling like I wasn't connecting with them, so many clerical duties and endless clicks. And then by the time I got home to see my family, there was nothing left over. And I was really kind of a jerk. And as a young father a decade ago, I knew something had to change. And I decided to start taking notes on what it was like to live the life of a doctor and a heart doctor, but actually feel like I had a heart myself that was quite empty and cold and shut off from others. And the book is about the process, not only that I went through, but that my patients, thousands of them now, I've helped them go through this process, and then sharing this with colleagues around the world, because I'm passionate about ending burnout in healthcare, kind of what works and what doesn't, and looking at the latest research in the field of cardiology, neurology, neuroscience, and psychology to give kind of a current view of the mind-heart connection.
Yeah, excellent. What an important topic to talk about. There is an epidemic of burnout in this country. And I specifically say in this country, and, I may be wrong because, there may be burnout in Western Europe. I certainly have never encountered, or maybe I haven't lived in India for, close to 15 years now. So I should not misrepresent by saying that, but certainly is a term which is used far too commonly in our vernacular in the US. Jonathan, you mentioned you used the term, and I'm going to put it in quotes and ask you more about it. You said traditional medical culture. What is traditional medical culture? Can you dive more into that for our listenership?
Yeah, there's Western medicine really diverged from Eastern medicine almost 3,000 years ago when the Roman surgeon and Dr. Galen first described the way that the heart pumped doing cadavers on animals. And at that time, most of the Western world and Eastern world had more of a spiritual and holistic view of the human heart. In the Chinese culture and traditional Chinese medicine, the heart and mind and spirit were inseparable, and they still are today. In fact, there's only one word. The word is shin. And in the Japanese culture, the concept of kokoro is very similar. So, and the same thing in ancient Greece. And so as Galen and then later on Vesalius in the 1500s and William Harvey started to show us more about how the cardiovascular system actually works, they found that in the heart and in the vessels, there was blood. And so that meant that there was no room for the spirit and for all of the emotions that we once thought the heart was filled with. And so there was this divergence in Western medical culture to see the heart and the body as merely a machine, no longer filled with these core human qualities of courage and wisdom and lightness and warmth and empathy and compassion. And that then is tied in with the modern industrial medical culture, which began over 100 years ago in the West, which is tied in with capitalism, which has driven us as physicians and PAs to work harder and faster with fewer resources and with less and less connection with the people that we're here to serve, which is our patients, leading to what some call moral injury. This feeling that something deep inside of us is broken because we're going into this field to help other people, and instead we're working inside of a capitalist machine that is driven by profits and, in the worst case scenario, driven by greed and many outside forces. And this is our culture, and this is sitting inside of the larger American and Western culture, which tends to respect the mind but diminish the value of the human heart in terms of the importance of human emotions, in human psychology, and even the importance of spirituality. So in our medical training in the West, this has been shown that beginning in the first year of medical school, the average student gradually loses their natural empathy, that ability to connect with others, because they feel threatened and overwhelmed. And part of the reason that my message is just one heart is that we have to recognize that what affects the physical human heart and its health also affects the spiritual, emotional, and social hearts, not just for our patients, but even us as physicians. We are disintegrating these different dimensions of our heart as we go through our medical training and find ourselves in a practice of cardiology or of medicine with now a 55% rate of burnout and a 10 to 15% rate of depression among physicians, which is going to lead to a shortage, at least in America, of between 100 and 120,000 physicians in the next 10 years. We have a crisis of healthcare, and I'm trying to be a small part of that conversation.
I mean, you are certainly addressing you're hitting the nail on its head, and you're addressing a very important topic, which will have public health ramifications. I mean, if we don't have physicians to take care of patients in this country in the next decade, it's a public health crisis. It's a public health emergency. And 100 to 120,000 is not a small number. And unlike other, consumer / marketing products, the supply chain for physicians, I mean, you know this. I mean, it takes several years to finesse the science and the art of medicine, and then it takes several years of practice to sort of ace your game. So, I mean, Jonathan, you've sort of touched upon as to how we've gotten here. I mean, over the past maybe a century, you said 100 years, the influence of capitalism, unfortunately, greed has sort of seeped into our healthcare system ubiquitously. And, we are looking at our throughput, we are looking at efficiency, we are looking at our productivity. And that has come at the expense of, physicians and physician assistants and allied healthcare professionals, mental health. I hope not patient health, although if you look at the metrics, if you compare all the countries in the developed world, I don't know if that's a term used in the modern vernacular anymore, but considering that it is, I'd rather say Western Europe and North America. We keep spending more money in healthcare, and we keep having worse outcomes by each year that we spend more money. I mean, how do we reverse engineer this? It's sort of like, when do we reverse engineer this? I think the answer to that is now.
Yeah, the relationship between our spending on healthcare in America and our outcomes, whether it's infant mortality and maternal health, that you name the metric, we're doing very poorly, and there are a lot of reasons for this. One of them is on the care side, which is the physicians, which we alluded to. If we ourselves are burned out, this is not simply a matter of being physically tired. When a physician is experiencing burnout, there are detectable changes in the brain and the physiology and working of the brain that's burnt out, such that the prefrontal cortex activity starts to diminish. There's a hyperactivity in the amygdala, and our ability to concentrate and make wise choices goes down, and the left prefrontal cortex activity, which is where a lot of our empathy and compassion is located, tends to also feel threatened, in this threatened sort of fight or flight state, often associated with burnout. So when you were saying perhaps it's not affecting medical care, we know that physicians and providers and nurses who are burned out give much worse care. The outcomes are worse. We may fool ourselves into thinking that we can work like machines because that's how we were trained, to go on little sleep and to work days on end. But we now know, just like there's a revolution in recognizing the importance of sleep on brain physiology, on cardiac physiology, we now know that burnout in the workplace is absolutely horrible for patient care and outcomes. And unless healthcare systems put as much emphasis on the well-being and holistic health of those doing the care, patients will not get good care. Now, that's combined with another epidemic, which is an epidemic of poor physical health and fitness among the Western world. 650 million people are obese. 30% of people in the West don't get any physical activity close to what's recommended. And the rates of diabetes are escalating rapidly. And this is why we're seeing 18 million die each year of heart disease, of heart attack. And most of it is preventable. So on the one side, we have the healthcare system, which is not caring for those giving the care because of many reasons, perverse incentives as among them. And on the other side, as a culture, as a society, we are disconnected with the core pillars of a healthy lifestyle, which include more important than anything, social connection, which is the number one determinant of longevity, according to most studies. So I know that didn't answer the question of how do we fix the problem, but I think it's, for me, worth lingering. And what are the different aspects of this crisis that we're in? It's really a crisis of health and well-being, as the way I see it.
Yes, no, I think in raising awareness and raising alarms is crucial, and sort of educating the workforce, our colleagues, is crucial. So thank you for being a beacon, for sharing this crucial knowledge with us. I'm going to start asking you about your role as an organizational well-being leader, because we start ushering in change by affecting our own microcosm. And that sort of, there is sort of like a domino effect. And the more people we touch, the more they touch others, and we sort of form a chain reaction. What is it that you've done so far in your organization as a well-being leader, Jonathan?
Well, there's lots of ways to think about how do you change an organization. It can be overwhelming. I find it helpful to think about organizational factors that are driving us towards burnout, and then individual factors which we have some control over. I'm happy, Ankur, that the conversation in this country has changed over the last 5 years. Initially, the discussion around burnout was around individual resiliency. It was a word that really was offensive to me, suggesting that I needed someone to help me be more resilient. I had gone for 20 years of training and worked many sleepless nights, something that some have never experienced in their life. I didn't feel like I needed help being more resilient. And I'm very happy that we have not now all seen that the driver of burnout has to do with organizations and their dysfunction, and placing a lot of the responsibility and the ownership on the leaders of organizations, from the CEO all the way down, even down to attendings and teaching fellows and residents. And the way that we lead and communicate can have a direct impact on the well-being and health of those beneath us. So with that said, the solutions that we have worked on in our organization are both organizational. In other words, very simply, we ask the physician leaders, what are the top 10 things that are getting in the way of you doing your job well? We think that the solutions have to be hard and complicated, but often it's a matter of making the day-to-day workflow more efficient, making the front desk talk with the back desk, being clear about what the core values of a clinic is, looking at the EHR system and all of the death by 1,000 clicks, and eliminating all of the unnecessary clicks. It takes me to read an electrocardiogram currently on the system that we use. I won't name it, but I think we all know what it may be. It takes me 14 clicks to do a single EKG. When that happens hundreds of times a day and in a week, eventually I become what's called cognitively overloaded. And so my attention goes to that instead of my patients. So my personal passion, Ankur, is around now individual flourishing, human flourishing. And so I'm bringing the principles of human flourishing into the workplace so that my colleagues, only if they're interested, nobody's required to join, but I have monthly programs now in the Department of Wellbeing and Resiliency, where we have several hundred people on the call every single month for the last 3 years. And for 45 minutes, the chief psychologist for the system and me guide doctors and nurses and team members in practices and principles of essentially the science of happiness, positive psychology. I've developed that. It's a 6-month program. And then the second part of the year, I have a separate program which teaches people the core practices for emotional and mental self-regulation, which is some people think is one of the essential skills of being an effective leader in a stressful workplace. And that's around mindfulness, compassion towards ourselves, empathy and compassion towards others, and reconnecting to our core values. So that's one example. We have dozens of initiatives, and the ultimate impact is that individuals say that even if the system isn't changing at this moment, they feel more grounded, better prepared to communicate more effectively, better able to grow consensus within their teams, and better able then to change the system from the inside in an effective way instead of a reactive way.
Yeah, no, I mean, these are, certainly, I mean, we could delve into these topics and, devote an episode to each. Jonathan, I do want to ask you specifically that when you hold these workshops, walk me through the affirmations, or walk me through some of the teachings that you impart to your listeners or to the audience, alongside the psychologists that you are partnering with. How do you structure these workshops? What are some of the affirmations that you share with them? How do you inspire to reverse engineer the lives that we find ourselves in? Walk me through the process here.
Yeah, and the other challenge here that healthcare systems face, like any community, it's one thing to create a culture for your family. Let's say you're married and you've got one child. It's not very complicated to talk about what your family's values are and to have conversations and do activities together. But once you get into the size of an organization that I'm in, which has 38,000 employees, it's a whole different thing to establish a culture of compassion. Especially when there are forces, again, like we've talked about, competition and greed and arrogance and all these wonderful human qualities. So a typical workshop lasts 45 minutes to an hour. There is a curriculum that everyone knows that is based around 5 pillars of positive psychology. And this is based on the work of Martin Seligman in the 1970s and 80s, who changed the field of psychology for good and said that the focus is no longer on only describing mental health disorders, but instead describing what it means to live a full and wonderful, rich life. And it turns out that it is like an equation. And as long as you have the elements in place, they're different for everyone. As long as you have the core pillars in place, it tends that you are a happier person. And so what I've done is I've rearranged these pillars into an acronym called SPACE, SPACE. And if you can do these 5 things each and every day, it's almost guaranteed you're going to find some joy and meaning in your practice of medicine, and even when you go home at night. And the first one is self-awareness and self-regulation. We all practice denial. We don't even face the problems that we have. We don't slow down long enough. And then often we don't regulate our emotions. If we're angry, we might yell or say something mean to someone else, bringing us down. And the key in SPACE is a positive mindset, which doesn't mean you should smile all the time and be happy. That's not what it means. It means that there is a proven benefit for people who are more optimistic, more grateful, and more kind. Those are positive mindsets. And it's possible to develop that, especially if you become hopeless, like I was when I was burned out. The A in SPACE means aligned, purposeful living. Aligned means when you're speaking to someone else, are the words you're using consistent with your core values? If you believe you're a kind person, did you just speak to your medical resident in a kind way, or was it possibly unkind? We make thousands of decisions each day. So A is that, and then C is about connection, compassion, and teamwork, and recognizing when we've lost our compassion for others. And lastly, E is about enthusiasm and leadership. So enthusiasm is having a sense of vitality in our lives. So a typical day, we pick one of those pillars, and there's a dozen or more themes within a pillar. For example, yesterday, we had a whole workshop dedicated to simplifying our lives. So we talked about all the ways that we complicate our lives and stress ourselves out, not even realizing we're making a decision. So for example, looking at our friends and our family, how much time do we spend with people that we really don't like, that really bring us down? And could we make choices to sort of clean up our social connections? Doing the same thing in our physical spaces. Is our office a mess? Is our home filled with clutter and distraction? Or is it clear? Does it allow us a place for reflection? And then lastly, looking at our schedule, just open up your calendar. Is next week filled with meetings that you are just dreading going to and that you're going to be frustrated while you're there and you're going to resent them after the fact? Or is it filled with activities that are aligned with your expertise and passion? So that's just one example. And we have interaction. I guide several meditations during it. And then we give home practices. We ask people to do these things over the next month. And then when we come together, I facilitate a conversation, again, with between about 150 and 250 people where we actually speak to one another as if we're together in a room. And the changes are dramatic. People come back and they talk about improved relationships with their family, with their team members, starting new initiatives at work.
Wow. I mean, thanks for sharing SPACE with me. I think I'm going to put this in my cath lab reading room and sort of just have this stuck up on a wall so that I constantly remind myself of this acronym, and thank you for coming up with this. Jonathan, I'm going to have you, go through the book with us, sort of that the structure of the book, for someone who's listening, who's interested, I hope that, the episode is further catalyst to people going online and ordering your book. I certainly want to do that as soon as we're done talking. Go through the construct of the book. How does it lend itself into the message that you want to share? I know that I was reading one of your LinkedIn posts in preparation for a conversation, and you mentioned how your father inspired you to come up with sort of like a template for a workshop for people to practice what you're trying to preach. So just walk us through some of the aspects.
Yeah, my dad was the town doctor. He was the cardiologist and the hematologist and all these. He'll be 98 years old. So, Dad, if you're listening, hello, and thank you for his suggestion. He said that the topics in the book are some things that people may want to discuss in a book club or a discussion group with a cath lab or a team. And so there's this whole section in the back called Questions for Reflection, Discussion, and Growth. And each chapter has just 3 simple questions that people can reflect on. And then it starts a conversation and we learn from each other. Ankur, the book has 2 parts. There's just part 1 and 2. And the first part is what's called State of Our Hearts. And it's really looking at ourselves, our organizations, and our society. And I tried to put it into the framework of what's happening with our hearts today that explains a lot of the conflict that we're seeing, social conflict, political conflict, and individual conflict that's leading to so much of the stress that is causing us to eat and behave in maladaptive and unhealthy ways, bad for our physical hearts. And I also in part 1 go over the science of the mind-heart connection. It's really designed for the lay public, but I have over 350 scientific citations in the back of the book that I reference along the way. So I'm hopeful that cardiologists will want to read this book so that they can bring this broader concept of the human heart into their interactions with patients, making them much more meaningful. And the concept is that we don't have this physical pump or this electrical pump that's just our heart. There are 4 dimensions of the human heart that have always been there through human history: the physical, the emotional, the social, and the spiritual. And it's only when we honor all 4 dimensions that our physical heart health can be optimal. And at first I thought this was just a theory, but I go back and I begin with the history of many worlds and wisdom civilizations and explain how throughout history, these 4 dimensions have been honored, but it's only in the modern Western world that they are disintegrating. And then I go through in chapter 3 and 4, what I call, using Takotsubo or stress cardiomyopathy as an example, I wanted to see what are the specific emotions that when we feel them and experience them, and our patients have them, have the highest risk for cardiovascular disease and poor outcomes. And they include, as you might not be surprised, the strongest data are for loneliness, anxiety, depression, burnout, grief, and workplace stress. So, and I go into the data on the linking each one of those with cardiovascular disease and health. And then in the next chapter, before we begin the solution, I describe what I've coined as the heart wakers. We have heartbreaking emotions, but we also have emotions that the field of positive psychology has now shown with joint research between psychologists and cardiologists. It's a field called psychocardiology or cardiopsychology. And I've interviewed 55 of these experts for the book. Something I call heart wakers. And these are the emotions that when we can capture them and experience them in our own lives, when we can bring them out for our patients and give them homework, while we're prescribing a medicine, we also prescribe them finding these emotions. These include joy, laughter, empathy, compassion, love, gratitude, and optimism. And I go over the data and all of the research, both retrospective, cohort studies, et cetera, showing the links between these specific emotions and improved cardiovascular outcomes. That's part 1. And part 2, I won't go through it all. Part 2 is, so what do we do about it? And the answer is we have to go back to what I have discovered are the 7 timeless traits of the human heart, which have stood the test of time, no matter what world religion, world culture, or scientific study you want to look at. These are These are not emotions. These are human resources, human intrinsic qualities that we all have that we can rediscover and strengthen. And the 7 timeless traits are steadiness or calm, wisdom or perspective, openness of mind and heart, wholeness, so living with integrity, courage, so living in the face of fear and living with courage, lightness of heart, which is a sense of joy and levity, and then lastly and most importantly, eventually getting back to having a warm heart. So the 7th timeless trait is warmth of heart. And we know that patients and doctors and nurses who connect with a warm, open, and even loving heart in the healthcare system, it improves immune function, it improves cardiovascular health, and it improves healing. And I go through patient stories and several pieces of evidence demonstrating that. And then the last chapter, chapter 13, is these 7 timeless traits in the workplace. And I have 7 leaders from around the world who have brought these practices and had tremendous success. And I show how that happens in our organizations.
No, the 7 traits that you've shared are just they're just tremendous. And I think the one question that I have for you is, how do you I know that I know we certainly have characters which have exemplified courage, even real life heroes which have exemplified courage. I think being a physician for your patients and is a courageous task, in my opinion. How do you impart the practice of courageousness to your listeners?
The point of this book, it's not a theoretical book. It's meant to be kind of a guide. So every chapter ends with specific strategies and practices that have the strongest evidence base for them. So, the first thing is to understand what courage is and courage isn't, and the myths around courage. We believe that, that person is brave and courageous, but I'm not like that. And that's okay. Instead, to realize that courage means experiencing fear. It means noticing and experiencing fear and working with the fear that we have in various ways. And I interviewed some psychologists on how to work with fear. And then once we've conquered our own fear, how do we then discover conviction? So courage is rooted in confidence in ourselves and in our abilities and trust in ourselves, but it's also rooted in a sense of conviction in terms of we are acting on behalf of something that is truly and deeply important to our core values. So how do we do that? And then the third element is competence. So often, we're afraid to do new things like putting in an A line or doing a procedure that we haven't done because we haven't done it enough. And so we can't fake it. We have to become competent and develop skills. So courage is about confidence, competence, and conviction, and managing fear. And there's steps to deal with each of those. There's a reason, Ankur, that courage is not the first chapter. I think courage is a more advanced skill. And the first chapter, the first skill in the how-to section is not about courage. It's simply about steadiness. And I describe a patient who comes into the emergency room bed A who's having ventricular arrhythmia. And I'm not going to talk to her about courage. I'm going to help her stabilize her heart rhythm first, and then we'll explore, what's going on in her life. And steadiness is the science of how stress throws us off balance and how we can find balance again through practices like breathing, bodily awareness, mindfulness meditation, cognitive behavioral therapy, and various other techniques.
Yes, and Jonathan, I mean, you're obviously a practicing clinical cardiologist. You are a wise person. I mean, you sort of had the insight to garner this wisdom through your own pain, and then transform your pain into purpose in putting this book together. And I'm certain that through this process of even transforming your own pain and sort of re-engineering or reverse engineering why you had lost the warmth and the connection to life as a busy practicing cardiologist in North America, you had garnered a lot of wisdom. What was something which you still learned as you were putting this memoir together for all of us?
Wisdom is something, and you use that word, and I wouldn't consider myself wise. It's something that I do value, though, and I'm seeking, and I'm constantly seeking. And I dedicated a whole chapter. Remember, this book I wrote for myself, and then maybe if my children want to read it and my patients and colleagues, that's fine, but for myself. And so you're asking a question, is what wisdom did I garner as I was writing the book? And when I think about wisdom, the first element is very counterintuitive. To be wise, we have to be humble. And so many of us and so many of our colleagues have lost that humility. I see our colleagues yelling at others or telling them what to do sometimes, and not respecting other people's opinion and thinking that we know everything. And so for me, the process of writing a book really helped strengthen my wisdom, because when I started, I thought that I would simply write down everything that I had learned in 25 years of medicine and in dealing with my own burnout and depression, and that would be the book. But what I didn't realize is that that was not the approach that my publisher recommended. Instead, they said, start by asking others for help in your research. And so I spent the first 6 months not writing the book, but interviewing more than 50 experts from around the world, trying to approach this subject of the heart, which I thought I was an expert in, as if I knew nothing. And then starting from scratch, in a sense, to see what was really true. So what I really learned, Ankur, is, at least for me, to write a book, and I hope it's a good book. People have liked it so far, but to write a book that's a nonfiction book, it's not a matter of putting yourself as an expert. It's more a matter of demonstrating true wisdom, which is beginning with humility and seeking out the expertise of others who have been there already.
Yeah, no, what a great answer on humility. And, that is something that resonates with me, something that, we see far too commonly in medicine is arrogance. I almost want to ask you, like, how did we get here? Like, why is there so much arrogance in medicine? What feeds it? And how can we abolish is not the right word here. I think, how can we inspire our colleagues to forego arrogance and imbibe or sort of practice approaching life through a humble lens? How do you do that? How have you done that?
Well, I in that question, I hear at least two questions. The first is, how can we change this so that we can have our colleagues be more humble? And my reflex, anytime I'm wanting to answer the question about how can we change other people, I always look back and I say, am I practicing this as powerfully as I can? And because I firmly believe that the best way to change others is to exemplify and embody the qualities that we want to see in others, and then we engage them in conversation and in activity and in friendship. And the second part of the question, which you asked first, which I think is even more interesting, which is, how did we get here? And I'm sad to say that arrogance is not going away. It's just baked into human nature. It's baked into human nature. It's one of the facets of the ego and this concern for ourselves, and this balance between, do we look out for ourselves in this world, or do we look out for others in the community? And that balance, which has been tenuous since humanity has begun, and perhaps will be for as long as humanity exists, is really what you're getting to with the question. Because I think arrogance is related to self-centeredness and selfishness and a sense of self-righteousness, which I don't think are bugs in the system. I think that we are wired to some degree to know that we're right. And unless we are intentional about choosing humility, choosing wisdom, which is seeking a perspective that is much greater than our own, in order to gain the full perspective, I think we tend to default towards towards arrogance, towards self-righteousness, towards selfishness. And there's nothing bad or wrong about that. I think it's part of the human condition. In order to make the change in others, we have to demonstrate it ourselves, which means when we've made a mistake, we have to apologize. We have to do the hard thing and say, I'm sorry. And it's even harder in medicine, where we have very strong hierarchical systems. And there's a huge social dominance hierarchy set up where you can see, even by how long someone's coat is in the hospital, exactly where they fit into the hierarchy. And so we're perpetuating this in a sense. And I'm hopeful that new concepts around leading with the heart, leading with empathy and compassion, will balance the more traditional models of commanding other people and conquering other people, both on the battlefield and in the healthcare system. And I think if you and I and others continue to have these conversations and exemplify these traits, I think that the next generation of doctors will have more humility, even while they have confidence. Humility is not self-doubt. It's not the same thing. It's a willingness to question oneself and to be open to other possibilities. And that's a really trick. In my own experience, if we commit ourselves to that, life becomes much easier because we don't have to be right all the time. We don't have to waste our energy proving ourselves right all the time. It's really exhausting. And we also have better relationships because we become more approachable and more human, and we become better leaders for the same reasons.
Yeah, no, several things here that you've said which resonate with me. And before we end this, because I know we're close to the end of the show, I wanted to ask you one specific question, which I've always wanted to ask. And, Jonathan, thanks again. I know, the work you do and your message and your presence online on social media, particularly LinkedIn, is, one place where I follow you. It resonates with me as sort of, I have written myself extensively on the intersection of spirituality and medicine, and this is exploring the same space. So thank you for the work that you've done. The one question that I have for you is, and this is, I think, based on my own experience in living in the US for the past 15 years, and also having traveled and lived in other parts of the world. I particularly find in culture in the US that it's just apology does not come easy, or the art of apology, or just the simple 3 words of "I am sorry." I don't know how else to comprehend it or maybe ask this question, but why do you think, this is you've sort of born and bred here, so you probably, I'm trying to find answers from a colleague who was born and bred here compared with someone like myself who was born and bred in the East. Why is "I am sorry" so hard to say for just the public here?
I think it's a great question. A couple of reasons come to mind based on my own experience. One of them has to do with the idea of manliness. So, not to separate men and women here, but it may be harder for men to say "I'm sorry" than for women. And I think this is because of some stereotypes of what a traditional masculine behavior is in the Western world, which, originated from rugged individualism. Go west, young man, was what they said in the 1800s in the US, and be an individual discoverer and find your own pot of gold. At the same time, we have kind of the Marlboro man who rides in on a horse, and there's this machismo there. And part of the traditional view of how a man should behave in the West, and I would also say, Ankur, in many cultures in the East, is to not feel the need to apologize and to almost be embarrassed and to be less masculine in a way if they admit to some flaw or fault, as if there's something wrong with them. Something else that comes to mind is just the phrase "I am sorry." There's having the word "I" and "sorry" in the same sentence. It almost makes it seem like that you are a sorry person. I personally prefer "I apologize," and then getting very specific about the thing that I've done that has hurt the other person and stating out loud the way that I have hurt the other person. So a good apology is not saying, I'm sorry you feel that way. That's a horrible apology. A good apology is saying, I apologize for what I've done that's made you feel this way, and here's how I am going to remedy the situation. So there's definitely an art of apology that has applications in healthcare. We've all had, quote, angry patients, right? We've all had angry patients where we bristle and we almost are afraid to see them. But once we get comfortable with being more human and being able to make an apology, which gets to another reason why there's an issue in our healthcare system. There's so much liability. And until we have tort reform and that we can't be sued for minor grievances, we are naturally disinclined to apologize in healthcare. And I think that's a great, great disservice, because some of the best interactions I've had with my patients, and I've made mistakes with my patients, but the best interactions I've had are the patients where I've made a mistake and I went into the room and I said, I apologize. I made a mistake and I'm really sorry for that. And those are the patients where now we can look back and laugh about it. But you're right, Ankur, there's so many reasons why we are either afraid to say I'm sorry, where we don't think it's a healthy thing to do. And we're also afraid about how it may make us look in others' eyes, as if we're less than perfect, just to acknowledge mistakes. So I think the remedy is to acknowledge what it means to be human, whether we're a doctor or a nurse. And what it means to be human is to be flawed and frail and to make mistakes and not be perfect. And to say that that's okay and to make space for that in healthcare, like we're having a morbidity and mortality rounds. That's not judgmental against the provider, but is intended to generate curiosity and learning. And I think we can learn a lot from that approach.
Yeah, excellent. No, I mean, I think the message here is just to embrace vulnerability, because the fact that we're human, we are flawed and frail by definition. Jonathan, this has been just a fascinating conversation. I mean, I can just go on, and in the interest of time and respecting your time and as well as other commitments that you have. And congratulations again for what seems like a great book. Any closing remarks for our listeners on your book, and any closing remarks for Parallax? And, once this is out, for sure, we'll be grateful if you can share with everyone else. And any closing remarks for the show?
Yeah, my closing remarks, my first remarks are for our cardiology colleagues, who I admire more than anyone else in the world. I mean, I will never forget, when a patient comes back from the operating room, but the sternum is left open for one reason or another, and the surgeon is there at the bedside and saving lives with compassion and incredible expertise. My colleagues in the cath lab, my non-invasive colleagues who are passionate about preventative care, some of the most passionate people I know. My message for my cardiology colleagues and really for everyone in healthcare is, can we start to see the heart a little bit differently? To remember that it's not just a mechanical pump and a mass of tissue that has an electrical system, but it actually may still be imbued with some of the qualities that makes us human, whether that's courage, joy, compassion, empathy, and love. When we can start to bring those parts back into the care that we give, it's actually better for our patients. And the research says that it's better for us as well. We have less stress day to day. We have more enjoyment in the work we do. And that creates a virtuous cycle where we get more joy and meaning from our work. So see the heart differently, treat the heart differently, and look at the 4 dimensions, not just the physical, but also the emotional dimension of your own and your patient's heart, the social dimension. Are you lonely or connected? And then lastly, and most importantly, the spiritual dimension. Whatever that means for you doesn't mean religion. It just means, can you connect with something that goes far beyond yourself and your small ego, whether that's service to humanity or connection with nature or to a God or a deity? Can we start seeing the heart in that whole integrated way? And as far as the book, It's called Just One Heart. So if you Google Just One Heart, Jonathan Fisher, you'll find it. Right now it's on Amazon, and I would be happy to hear anyone's feedback once you've gotten your hands on it. I'd love to hear your thoughts and how it's impacted you.
Excellent. And, we will make sure that the links are included in the show notes. Thanks again, Jonathan, for an incredible conversation. To our listeners, thank you for joining us another Monday. We do value your feedback. Please share your feedback with us on SoundCloud, Spotify, and Apple Podcasts, or do write to Jonathan or myself. Our emails will be in the show notes. Once again, we'll see you another Monday. Thanks for tuning in.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app, or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.